Hello and welcome back to my channel. So before starting the vlog for today, I would like to request, if you are new to my channel or if you have not subscribed to my channel yet, please do subscribe it and also press the bell icon so that you get notified every time I come up with a new video. So as you have already seen from the thumbnail that today's topic of discussion is about depression. So we all know that depression is a kind of a mood disorder, and before understanding more about depression, we will understand that what type of mood disorders are actually there. So types of mood disorders, there are two types of mood disorder. One is the neurotic disorder and the other one is the psychotic disorder. Neurotic disorder को हम लोग neurosis भी बोलते हैं and psychotic disorder को psychosis बोलते हैं. So what happens, the psychosis is more dangerous than the neurotic one because in this the person doesn't know the reality, okay? And whereas in the neurosis the person knows the reality but still he or she is compelled to do that activity, okay? So the most common neurotic disorder is the anxiety, and also depression is also a neurotic disorder, and OCD is also a neurotic disorder. Okay, so what happens that we will understand from an example of reactive depression. So what do you mean by the reactive depression? Basically in this you know that you are not suffering from depression, okay, but still there is some past traumatic memory inside your brain which you cannot exit from, okay? That cannot be erased from your mind map, and because of that it is causing a kind of depressive thoughts inside you. That is called as reactive depression, okay? Also in the neurotic part there is this neurotic disorder, there is phobia also a part of it. Phobia means what? Phobia means that the fear from a person or anything, that is called as phobia, okay? So now we will discuss about the psychotic disorder or the psychosis. Basically in this the person is far away from the reality, and because of that there is a distortion of the memory, thought and perception of that person, okay? So in this there are three types of psychotic disorder, which is the illusion, delusion and hallucination. Illusion means that you have perceived a real stimuli, but after a time you have came across that that was unreal. Means supposedly आप किसी अंधेरे कमरे में हैं एंड वहाँ पे आपको लगा कि स्नेक है, ओके, लाइक सांप है, बट आफ्टर मतलब आपने लाइट जलाया एंड टॉर्च वगैरह जलाया तो आपको ये पता चला दैट वो सांप नहीं था, एक रस्सी थी, ओके? मीन्स दैट यू हैव परसीव्ड अ रियल स्टिमुलाई बट you were wrong about the thought which came into your mind, okay? So that is called as illusion. Then the second one is delusion. What is delusion? Delusion means false, firm and fixed belief about something which you cannot prove otherwise. So the last one is the hallucination. Hallucination means that the misconception about any sensory stimuli, be it the visual or the auditory, okay? So what is depression? Back to our topic. Basically depression is associated with the feeling of a person being very happy or very sad at a moment, okay? So see, there is a pendulum like movement of our thoughts, like we can become sad, very sad, very very sad, or normal, or we can become happy, very happy, or very very happy. So when this swing happens like this, like one moment we are sad and one moment we are happy, that is called as bipolar disorder, okay? Or we can call it as bipolar depression, okay? So it is always associated with the feelings or the mood which we have, like one time elevated, one time lowered, okay? So that is called as depression. So what happens that it is very difficult to understand about depression because it is something which is invisible. Basically there are symptoms, but the symptoms are related with the feeling of that person, okay? So how can you understand that whether the person sitting just in front of you is depressed or not? So being a doctor, there are two signs which you can understand, to know that whether the patient who is coming to you in your clinic, whether he or she is suffering from it or not. So there are two types of sign. One is the Virgut fold and the other one is omega sign. Virgut fold क्या होता है? Means the upper eyelid and the nose के बीच में आपका एक triangular fold बनेगा, which is called as Virgut fold, and the other one is the omega sign. Omega sign means क्या होता है? forehead पे मैथमेटिक्स में ओमेगा सिंबल था, सेम वैसा ही आपको एक सिंबल देखने को मिलेगा, तो आप देख के पता पता लगा लोगे दैट वेदर द पर्सन इज सफरिंग फ्रॉम डिप्रेशन और नॉट. ओके. So what are the symptoms of depression? Basically, all are because of the endogenous causes, like feeling of worthlessness, hopelessness, restlessness, and helplessness. There is a lack of joy, lack of energy, lack of interest, lack of mood, lack of concentration. There is significant weight loss seen in that person, and also sleeplessness, which is called as insomnia. And yes, we can remember it from a code which is EMI, means no energy, no mood, and no interest. At least these three symptoms you can remember. Okay. If these symptoms are persistent with you from 2 to 6 weeks, we can say that you are suffering from depression. Okay. So yes, then we will discuss about the type of depression. So the type of depression, single episodic means one attack, okay, of depression has came to the person. The recurrent means बार बार ऐसे attacks आते रहते हैं. Chronic depression means क्या होता है, when that person is having more than 3 attacks, that is called as chronic depression. Okay. And then what is resistant depression means after taking the treatment also your depression is not sorted, that is called as restricted depression. And so in the atypical depression, there is hypersomnia, means that patient have an increased sleep cycle, and then there is increased weight of that patient, and also weight because of increased appetite, and also there is a sudden elevation of the mood of that patient and suddenly it drops. That is called as atypical depression. So now we will understand some common disorders which are related with the depression. One is the dysthymia, means when the episodes of depression are lasting for more than 2 years, that is called as dysthymia. The other one is a premenstrual dysphonic disorder, in which the lady who is going to have her menses, okay, will have episodes of depression, and that is seen for more than 2 to 3 cycles. That is called as premenstrual dysphonic disorder. So the other one is the involutional melancholia, in which it is a type of depression which is a classic psychiatric traditional depression, which is seen in the elderly, late elderly, in which there are signs of depression like hopelessness, restlessness, helplessness, and worthlessness seen in that old age people. The other one is hypochondriasis, in which a person who is normal, but he always used to think that he or she is suffering from any kind of disease or disorder. Means अगर आपको बीमारी नहीं है फिर भी आप सोच रहे हो कि आप बीमार हो, that is called as hypochondriasis. Okay, that is also a disorder which is caused by depression. So now I will tell you the pathophysiology part of depression. So there are certain neurotransmitters like dopamine, serotonin, adrenaline, and noradrenaline. So what happens, they used to transmit from the synapse, one synapse to the other synapse, okay, and these are responsible for our mood. Okay, so while they are being transferred from one synapse to the other, there is a gap left in between the synapse, that is called as synaptic cleft. So there is an enzyme present there, that is called as MAO. Okay, so what it does is कि when जो आपके न्यूरोट्रांसमीटर्स होते हैं वो ट्रांसमिट हो रहे होते हैं, तो वो बीच में उसको जो है डिग्रेड कर देता है, उसको ख़त्म कर देता है. बिकॉज ऑफ दैट देयर इज़ अ डिफिशियंसी ऑफ सर्टेन न्यूरोट्रांसमीटर्स. ओके, सो इसकी वजह से क्या होता है कि मूड स्विंग्स होते हैं इंसान को. सो अब हम क्या करेंगे इस चीज़ के लिए, हम लोग इनिबिटर्स का यूज़ करते हैं एज अ ट्रीटमेंट. लाइक माओ एंजाइम है तो उसके लिए माओ इनिबिटर्स का यूज़ किया जाता है. और क्या होता है कि जो न्यूरोट्रांसमीटर्स होते हैं जब वो ट्रांसमिट हो रहे होते हैं एक सिनैप्स से दूसरे सिनैप्स पे, तो उसका वापस से रीअपटेक होता है. ठीक है, तो इस रीअपटेक को रोकने के लिए हम लोग इनिबिटर्स का यूज़ करते हैं. लाइक सेरोटोनिन, एड्रेनलिन एंड नॉर एड्रेनलिन के लिए रीअपटेक इनिबिटर्स बने हैं, बट डोपामीन के लिए नहीं बने हैं. बिकॉज फिर वो एक सिनैप्स से दूसरे सिनैप्स जब जाता है तो वो वापस रिटर्न नहीं करता है, इसलिए उसके लिए कोई इनिबिटर नहीं बना है. सो यस, ऑल्सो हम लोग ट्राईसाइक्लिक एंटी डिप्रेसेंट्स का भी यूज़ करते हैं. तो वन बाय वन मैं आपको सबके नाम ही बताऊँगी. So what are the drugs? Like for the MAO inhibitor, there is macrobamide, and for tricyclic antidepressants we have amitriptyline, protriptyline, also imipramine. Imipramine जो होता है वो और भी चीज़ों के लिए यूज़ किया जाता है, जैसे कि नॉक्चुरल इन्यूरेसिस मीन्स बेड वेटिंग के लिए, ठीक है, वो एक ड्रग है अच्छी. ऑल्सो ट्राइजेमाइनल न्यूरल्जिया के लिए भी ये बहुत अच्छी ड्रग मानी जाती है. ओके. So the other ones that are the SSRI is the best one, selectin serotonin reuptake inhibitor. ये बेस्ट होता है, ठीक है. ऑल्सो इसमें कौन कौन सी ड्रग्स आएगी, लाइक डेपोऑक्सीटेंस, फ्यूरोऑक्सीटेंस एंड पेरोऑक्सीटेंस. सो बेसिकली क्या होता है कि ये खाली डिप्रेशन को ट्रीट करने के लिए नहीं होते हैं, लाइक एंटी, जो अभी मैंने बताया आपको, ट्राईसाइक्लिक एंटी डिप्रेसेंट्स एंड SSRI, ये सब और भी चीज़ों के लिए यूज़ किए जाते हैं, लाइक न्यूरोपैथिक पेन. ओके. And like migraine or ADHD means attention deficit hyperactivity disorder, like earlier I've told you in this video, that is the premenstrual dysphoric disorder, or we can say that OCD. okay. and social phobias के लिए, मतलब कि ये सब दवाएं जो है डिप्रेशन के अलावा भी यूज़ की जाती है, ठीक है. और SNRI जो मैंने आपको बताया, लाइक सेरोटोनिन एंड नॉर एड्रेनालिन रीअपटेक इनहिबिटर, उसमें ड्यूरोऑक्सीटेन आता है, ठीक है. दैट इज़ ऑल्सो अ वेरी गुड ड्रग. And these are the drugs which we use for depression. So not only these drugs but many more drugs come under these headings that I will put in the video. Also there are certain drugs which can induce the depression, means they can cause the depression, like beta blocker, oral contraceptives, or methyl dopamine, or interferons and barbiturates. They can cause depression. Okay. So yes. So that is it for the vlog. Hope you guys have liked it, and if you did, please don't forget to like, share and comment. Also don't forget to subscribe my channel and press the bell icon so that you get notified every time I come up with a new video. Also, if you have any query regarding the topic which I have taught you today, or any past queries, you can ask me in my comment section. And if you want me to make any video on the topic which you want, you can tell me that also in my comment section. And till then, take care.